Hello, for your CNA fans, and welcome to another episode of Career Spotlight Saturday, where we interview healthcare providers in different aspects of healthcare so that you can decide if there's another healthcare career that might be right up your alley. Today, we're going to be speaking to Jim, and he's a physical therapist, and I'm super excited about this interview because I want to know a little bit more about physical therapy. So, thanks for joining us. Hi, Jim.
Hello, how are you?
Good, how are you?
Very good.
Thank you for joining us today. I know our audience is super excited about this one. So I understand that you work in medicine. Can you tell us a little bit about your title, what you do?
Yeah, I'm a physical therapist. I work at a local hospital here. I usually work in the ICU.
Okay.
So that's the floor I'm usually on. I mean, I've been to all the floors in the hospital, kind of started out in the orthopedic floor, and then all the floors in the hospital. But within the past probably 2-3 years, I've mostly been in the ICU.
And that's kind of interesting because I didn't realize that physical therapists kind of specialize in different areas of the hospital. So that's kind of an interesting thing as well.
So for some people, they kind of, once you kind of get into a spot, you kind of like that. You know, that's like your forte, if you will.
Okay.
So we have some therapists that kind of do all the orthopedic cases. So some of the PTs and PTAs, they work mostly on the one floor, which is all orthopedic. Myself and one of the PTAs, we kind of work in the ICU most of the time. We have some that will work on the oncology floor, or it just depends on where you're kind of assigned. But you should be able to work in any area of the hospital.
Okay, so what does it take to become a physical therapist? What is the requirement?
Well, that has changed. I've been doing this a long, long time. When I first started, it was a bachelor's degree. So
Okay.
I have a bachelor's degree, and about the year after I graduated, it went to a master's degree, and now it has gone to a doctorate degree.
Wow.
I am lucky to be grandfathered through all those phases.
Okay.
But now anyone that graduates a physical therapist will have their doctorate in physical therapy.
Wow. So just for our listeners that aren't aware, a bachelor's degree is a 4-year program. A master's degree is somewhere
About
around 6.
correct.
And then a doctorate is
8
closer to
years.
8.
Yes,
yeah.
yes, 8
So a
years.
lot of education.
Yes.
And a lot of people just think that physical therapists exercise people, right? They move body parts.
Uh-huh.
So why do you need 8 years of education to move body parts?
That's a good question, but like I said, I mean, I was grandfathered in. So I think originally the reason the APTA kind of went to the doctorate degree is I think they were hoping to be more along the lines of a chiropractor, and they wanted to have some autonomy, especially for independent physical therapists that have their own practice. So they wouldn't have to work so much under the control of a doctor. They would be able to do more stuff much like a chiropractor.
Okay.
I don't think it has panned out to that degree. You're still under the guidelines of a doctor. You still have to have a script from a doctor. You have to have the okay from the insurance company and all that stuff. So for the most part, now it's just having that degree, but I don't think they got the autonomy that they were hoping for to work under.
Okay. Very interesting.
They can do an evaluation without a doctor's script, but beyond that, you still need the doctor's
for the treatment part.
Yes, you'll still need the doctor's prescription.
So that brings up a really good question. So physical therapists work in many places other than just the hospital.
Absolutely. So when I first started out, I worked in a hospital for a couple of years, and then I went out to home health. So you can work in a home health. You can also work in a private practice. You can work for the school system. Yeah, the children with cerebral palsy and stuff like that. So there's a lot of different areas you can do. Obviously, you do sports medicine. So you can do pediatrics. There are numerous areas that you can.
Wow, so the field is wide open. It kind of appeals to any aspect of what you're into. So
Yeah,
that's
yeah.
really
Yeah, the
great.
home health is nice. It's a little more flexible with your schedule. So it kind of depends. When I was younger and my kids were younger, I was doing the home health. It was nice because my schedule is a little more flexible. Now working at the hospital, it's more of a 9 to 5 kind of thing. So.
Very good. So tell us a little bit about what you do on a day-to-day basis. I mean, what does a day in the life of look like for you?
Okay, so when I get into work, usually one of the other therapists has assigned everybody. So again, because certain therapists kind of work in certain areas, so we'll pick up our schedule, we'll get who we have. You'll do a chart review on that patient before you do that. Also in the hospital, there are physical therapy assistants. So physical therapy assistants, which is a 2-year degree, they will do all the treatments. So the physical therapists tend to do all the evaluations.
Okay.
We can obviously do treatments as well, but we tend to do mostly evaluations. So I'll come in, I'll get my schedule, I'll get my list of patients, I'll do a chart review on them, and then I'll go up to the floor and do my assessment. So basically my assessment is I'm going to assess their ability to move around in the bed, I'm going to assess bed mobility, I'm going to assess their ability to transfer, I'm going to assess their balance, I'm going to assess their gait, I'm going to assess their muscle strength, and kind of get an idea of where they are at with all of that. That's kind of lays our groundwork for then what we set up will be a treatment plan. And then we set up a treatment plan with goals, short-term goals, long-term goals, and then typically we don't see them again. The physical therapy assistants will then do the treatments and see them for those visits. If they're there in the hospital longer, then usually about 2 weeks, then we come back around and we will do a reassessment and see where they are. Have they met their goals? Have they changed anything? Has their status changed? Do their goals need to be updated?
Very good. So, in a very real sense, you're in charge of deciding or looking at where the patient is, deciding what they need to meet goals, and then assessing to make sure that they're on the right track, or if the goals need to be modified.
Yes. Also, their discharge plan. We kind of the case managers will look at our assessments and they want to see, does this patient need to go to a rehab center? Does this patient need home health? Can they just go home? Do they need any physical therapy? Sometimes we'll get an order and you go see the person and they're independent. They do not need. So then we'll just, say that they're independent. They don't need physical therapy at this time. Other times you'll say, okay, this person is pretty weak. Their ability to walk is pretty poor. They'll need to go to a rehab center of sorts.
And that's really, really important. I mean, and I kind of want to stress that is that you're part of the treatment team, the entire team that's taking care of the patient. Because we tend to think of patients as being sick or well. And what we have to understand is there's a big gap in between, and things get a little murky there. And, a lot of people, you go into the hospital, you're sick, you get better, you go home, and you don't, when you're younger, you don't think about, beyond that. But there's a lot of people that when they're sick, they become very weak, or they're on new medications and their balance and gait is, is affected with that. So looking at, it's not as easy as, okay, you're better, go home. We have to plan for, can they effectively take care of themselves at home? Do they have the resources in place, or do they need a rehab or outpatient therapy, or those types of things to make that transition?
That's what I like about working in the hospital. There is a medical team, a group. I mean, in ICU anyway, they do rounds every day, and so you have everybody there. You have the pharmacist there, you have the dietitian there, you have rehab there, you have the nurse there, you have the physicians there, and they round on each patient, and you kind of reassess every day to see what they're doing and how they're doing. So.
And that's so important to understand that the entire team really is very interconnected for the well-being of the patient. It's not just doctor-patient.
Correct.
There's so many other modalities
Parts,
involved.
yes.
So that's really, really fascinating to me. So is this let me ask you this, is this a field that you would recommend for somebody that may be looking at, okay, I'm a CNA now, or I'm an LPN now, and this is good, but it's not really where I want to be. Is physical therapy something that you would recommend for somebody to take a look at?
Well, obviously I am a physical therapist, so of course I would obviously recommend physical therapy, but also being known now that it is a very large commitment, time-wise and also money-wise. It's a big commitment now to have your doctorate, to go to school for 8 years, get your doctorate degree. There are other avenues. There are a physical therapy assistant. There's also, occupational therapy, there's speech therapy. So we have other therapists in our department, and there are other avenues if that's where you choose to go. So yes, I recommend physical therapy all the time, but I also tell people, look at some of the other things. If you think 8 years and a doctorate is a bit much, there is a physical therapy assistant program. There is, speech. There's occupational therapy. There's being a physician's assistant. So there are other, and I always recommend nursing. I mean, my wife is a nurse, and nursing is also a very good career to.
Yeah, as an
to step
RN,
to.
I can attest to that.
Yeah,
I love being a nurse.
Yeah.
But I'm always fascinated to hear some of the other types of healthcare providers that are out there as well, and that's just fascinating. It's great advice, and 8 years is a long time, and it's a lot of money.
Yes.
Commitment for that as well. So you really kind of have to have a passion for what you're doing if you're going to stick with it that long.
Absolutely. We've had some of the physical therapy assistants look at going on to become a physical therapist, and when they kind of weigh the financial aspect to the financial gain, sometimes they're like, I don't know if it's really worth that investment. So there is an investment in there. But
Right. But if you've got the heart for it, go for
absolutely,
it.
absolutely. I would never discourage anybody. It's a great field.
So what is a piece of advice that you would like to give our listeners about working in medicine? Do you have any words that you would like to pass on?
It's very fulfilling, actually. I can definitely say that. I mean, like I said, I did home health for quite a number of years. Kind of out there by yourself doing home health. I really enjoy working in the hospital setting. I really feel as if you are part of a medical team. And just the patient interaction really is the best. It really is rewarding. When you see somebody that, is really, really weak and have a long way to go, and when you see them come back and you see them kind of progress, it is gratifying. It is very satisfying to see that. So
definitely a fulfilling
yeah,
role. That's the thing that I've always loved about being in nursing and medicine, is that you really do feel like you make a difference.
Absolutely.
And I do highly encourage anybody to look at medicine for that aspect of it.
Yeah.
Well, we'd like to thank you for coming and spending your time with us today. This has been
welcome.
very illuminating, and I'm sure that our listeners and viewers really appreciate your time. Well, thank you very much for joining us today for another episode of Career Spotlight Saturday, and join us each week on Saturday where we spotlight the career of a different healthcare professional so you can figure out where you fit in healthcare. Make sure that you like this video if you enjoyed it, subscribe, and ring the bell for notifications so YouTube will let you know when we post another video. Please tune in for our other weekly series, Motivation Monday, Test Tip Tuesday, Workplace Wednesday, Newsflash Thursday, Fashion Friday, and of course, Career Spotlight Saturday. We hope to see you soon. Until next time, happy caregiving.